technical difficulties, sorry. So, I'm going to go ahead and get started because we're running a little behind. I apologize. So my name is Eva Tukuafu. I am one of the licensed clinical social workers here for the Department of Neurology. So I primarily work with a lot of our terminal neurodegenerative diseases, but also kind of help out in many roles in the department. So today, our providers asked me to talk actually initially about cognitive behavioral therapy, which we are going to talk a little bit about. But actually, I wanted to talk kind of more broadly about behavioral treatment for headache and migraines and kind of what we know based off of the research. And also a lot about how to make that treatment actually be successful and worth your time and money. So to start off with, the pretty picture is cut off, but as you can tell, it's a picture of our institution. As far as disclosures go, I don't have any. I am not special enough nor paid enough to have any. But today, what I want to talk about with you guys is, first of all, what therapy is and what it isn't, right? So thinking about this in terms of headache and migraine, what would we use it for? What can it accomplish? And what it cannot do or doesn't do. Oh, there we go. Look, PowerPoint finally decided to open. Oh no, and now it's opening twice. So, let me do this. Ah! No! Okay, someone possessed my computer, so I don't know what's going on right now. But a lot of things are happening. Let's see if that'll go. There we go. Okay. All roads lead to Rome. So today what we're going to talk about is what therapy is, what it isn't, also factors and things for you to consider to make therapy successful, again, worth your time and money. We're going to talk about therapeutic modalities that have some good research behind them specifically for headache and migraine. And also, I'm going to hold your feet to the fire and make you do a couple therapeutic exercises with me that you can kind of use out and about and broadly. So first of all, what I wanted to talk about is when we say behavioral therapy, what does that mean? So in our current society, these terms are all kind of used interchangeably, right? So when people talk about psychotherapy, behavioral therapy, psychological treatment, mental health therapy, talk therapy, mental health treatment, behavioral treatment, therapy, they're really talking about the same process, the same kind of treatment modality. And really what that's based around is what is therapy? So all of these different names are essentially referring to an active treatment process to help improve mental, emotional, and psychological well-being. Therapy is also about a relationship between you and a licensed mental health provider. It's a dedicated space for you to work on healthy coping techniques. It's a safe space to process difficult experiences, memories, emotions. It's a way to create change in your life that you apply. And it can be short-term, a few sessions, or it can be long-term that takes place over months or years, kind of depending on the issues that are involved and what you need help with. And this can be done with or without mental health medications. They do similar things, but they do different things, right? So mental health medications are really looking at your chemical levels, and while that can change in psychotherapy or therapy as well, it also is about giving you kind of new ways to think about the world or the issues that you're facing. What therapy isn't is a magic bullet or a quick fix. It is not an answer to all of life's questions. It is not a constant venting session. The goal is not for you to come in and just download on your therapist every week about the things that are wrong with your life, although certainly some amount of processing happens. And it's not you lying on a couch talking to a silent German man. As our little comic here illustrates, a lot of people only think about therapy in terms of maybe what they've seen on TV, where it's, you know, some guy taking notes with glasses and you're laying on a couch and you can't see them. Therapy is many, many things, and that is one particular way that therapy can be practiced. But there are literally hundreds of other ways that therapy is practiced. So the next question is, if that's what it is and that's what it isn't, does it work? So the most common complaint I hear when I talk with people is, you know what, I went in, I tried to talk to someone once or twice, just wasn't doing anything, so I quit. So when we look at the research on people who engage in therapy, what we see is that actually for the vast majority of people, it does help. And it can help in a lot of different ways. So we know that it can improve emotions and behaviors. It is tied to fewer sick days being taken at work and less disability. It is tied to fewer medical problems in general and increased work satisfaction. And it actually leads to changes in the brain that we can actually image in our imaging machines, and we can compare it and see similar changes that can take place with some of the medications. So it's really it really is doing something in the brain, right? So 75% of people who enter therapy will say that somehow they gain some benefit from it in one or any or all of these areas. So what about the other 25%? Why is it not helpful for the other 25%? So a lot of times, this is about that there's some factor at play that is not making this an ideal or a successful therapy. So there's really three things that go into making therapy successful for you. So the first is the type of therapy. So this is like, what kind of framework or therapeutic model are they using? Because just like medical treatments, there's a lot of different types of treatment for different mental health issues, okay? It can be your willingness and motivation. This is an active process. If you don't want to do the work, or if you don't take the recommendations given, if you don't change something, nothing is going to change, okay? And the last, which we're going to talk about a bit more, is the therapeutic alliance. And I'm going to explain what that means and why it's so important and why I wanted to make sure we really talk about that a lot today. So first of all, let's talk about types of therapy, okay? So these are all the different types of therapy, and sometimes kind of the term that's used professionally, but what it actually means about the therapy, okay? It means, like I said, we use different tools for therapy just like we do in all medical treatment. So there's arts or creative therapies, right? So using the creative process to help you find more meaning or balance or communication skills. Behavioral, which means that it's exploring the way you act, right? Your behavior. Cognitive, exploring your thoughts and the way you think and how that influences your experience. Dialectical, which explores opposite positions and how they might exist together. Sometimes we can believe two things that conflict, right? So I can believe, for instance, that I'm not good at something, right? If I'm maybe giving myself negative self-talk, I'm not good at anything, but I also know in my job, I'm really good at scheduling. Those are two opposite beliefs, actually, if you were to sit down and look at them. So dialectical looks at exploring those opposite positions and how to work with them in your life. Humanistic focuses on the individual as a whole, so mind, body, spirit, and soul. Mindfulness-based, which we're going to talk about a little bit more, involves becoming aware of all your current thoughts and feelings and accepting them. It often involves mindfulness techniques, some of which we're going to practice today. And person-centered focuses on your strengths and insights about yourself to encourage personal growth. Psychoanalytic, or analytic, is that old Freudian model, right? The quiet guy in the corner, and you just talk about your mom and your dad and all of your unconscious feelings. And this explores, as I said, your unconscious thoughts and how maybe your unconscious is affecting how you act in the world. There are very few true psychoanalysts in the world today. More commonly, someone from this frame of reference will do more what's called psychodynamic or dynamic, which explores how your unconscious thoughts might affect the way you act. Solution-focused is what it's called, focusing on what you want to achieve now and in the future, and doesn't go back into past stuff. And then, I think most importantly, and the vast bulk of therapists out there are going to be what's called integrative or blended, right? So this is, if these are all the tools in the toolkit, depending on where the patient, or where the client is at and what they need, we can use different techniques at different stages and points. So, the piece about your motivation and willingness, okay? This is one of my favorite Mark Twain quotes. So 20 years from now, you will be more disappointed by the things that you didn't do than the ones you did do. So throw off the bow line, sail away from the safe harbor, catch the trade winds in your souls, explore, dream, discover. So the therapeutic process requires you to act. It requires you sometimes to do things that are uncomfortable, because we develop habits and patterns for a reason, and challenging that can be really difficult. Some people, a lot of patients I've seen, quit therapy because it doesn't feel safe, right? It doesn't feel safe to have to change. It's more comfortable to kind of stay and keep doing the same thing I'm doing, even though I'm miserable and I'm not happy about it. But it's harder to change than it is to just kind of keep the status quo. But one thing I would really encourage you to think about if you do choose to add therapy to your headache and migraine management is really thinking about this less as something that's scary and threatening, and more as an opportunity or an adventure to explore more, okay? More about yourself, more about your life, more about your loved ones. So your motivation and willingness has to be there. The last piece is therapeutic alliance. And what that means is that therapy ultimately is hugely impacted by your relationship with your therapist. So if we look at all of the studies that have been done over all the years, what they found is that therapeutic alliance is the #1 predictor of treatment outcome. The quality of your relationship with your therapist, regardless of what type of therapy they are practicing, will more strongly indicate whether or not this is going to be something that's going to be beneficial to you. So when we talk about that, sometimes we say, sometimes in therapy, really, the relationship is the therapy, right? So working with this provider that you trust, or that you really feel like has your best interests at heart, that it can oftentimes be the greatest catalyst for change, the greatest catalyst for growth. So what does it mean? Qualities of a good therapeutic relationship. So of course there has to be mutual trust and respect and caring. You want to, as I mentioned, you need to be able to believe that your therapist isn't trying to manipulate you or force you to do things you don't want to do, that they're really acting in your best interest. They want to help you. They want to help you get better. You have to have a general agreement on the goals and the tasks of therapy. So what are we trying to accomplish? What is it that you need? What is it that you want in your life? It has to be shared decision making. So it's a dynamic process, right? You and the therapist need to make these decisions together, using their clinical expertise and your personal life expertise, right? You both have to be engaged in the work, okay? Therapy is work. Mental health therapy is work just as much as physical therapy is, right? You get exercises, you have to do them, you have to try them, and guess what? If you don't do them, you don't get better. So it does require a commitment that you're going to do the work and the therapist is going to show up and do their portion to help give you the things that you need. There has to be agreement on the means for change. So for instance, on those types of therapies, how do we feel like it's going to be best accomplished? What's our plan to accomplish these goals of change in therapy? And then the ability to talk about the here and now aspects of the relationship with each other. And what that means is that with your mental health therapist, sometimes things are going to come up that you feel really uncomfortable, or you suddenly feel scared, or you suddenly feel anxious. And in mental health therapy, it's really, really important that in that moment, you also discuss that with your therapist. So, what you just said to me, I'm kind of freaking out. Like, I don't know how I feel about this. Like, I'm feeling very, very anxious right now because of what we're talking about. That feedback, that emotional feedback, is really, really crucial to the therapeutic process. And it's not something we typically ever do with people, with professionals in our lives. It's something we sometimes are good at with our friends or our family members. But in therapy, it's actually a huge tool for helping you figure out more clearly what's going on. So, and the freedom to share any negative emotional responses with each other. So, you just said that to me, and you just told me I need to try harder at this particular technique, and that makes me feel like you don't think I'm trying at all, and I really am here trying. I'm trying. So sometimes there is going to be negative emotional responses sometimes, again, that here and now aspect, being able to communicate, and sometimes that isn't here and now. Sometimes that's later on. So sometimes I come back to therapy after kind of processing over the last week what we talked about and what went on, and after thinking about it, it really didn't work for me how you said that. Like, it really made me feel angry, or it made me feel sad. But communicating those negative emotional responses, again, is actually a glimpse that can help us delve deeper, right? There's some kind of trigger point there, right? There's something important there, or we wouldn't be sad or mad or upset about it. And it's the ability to correct any problems or difficulties that may arise in the relationship. So as a therapist, if my patient comes back and says, you really made me so mad with that thing you said to me last week, my job is not to be like, well, and get very defensive, okay? My job is, okay, let's talk about this. Where do we think this might be coming from? Was there something in particular? What about it didn't work for you? Okay, and being able to work through those negative, intense, or heavy feelings versus running away from them or just quitting altogether, okay? So I cannot stress enough that the importance of this therapeutic alliance, the importance of you finding someone that you feel comfortable with, that you feel comfortable having difficult discussions with, and that you feel like is in this really truly to help you because they care and they want to help make things better for you as well. So, if at first you don't succeed, try again. I just thought this one was funny. I liked it. But, the example I use sometimes is that if you went to a doctor and you didn't like the doctor, maybe the doctor was a jerk or something, I don't know, and you really didn't like them and you didn't agree with them, you don't stop going to the doctor, right? You go to a different doctor. Again, this is the same in mental health as it is in health, right? If you wouldn't give up on your doctor, don't give up on therapists, okay? If you don't like a therapist, if you don't feel that connection with them, if you don't feel like you're going to be able to be comfortable having hard conversations with them, don't give up on therapy. Find a different therapist, okay? So a big piece of this, because that therapeutic alliance is so important, is finding someone who you feel comfortable with, who you trust their professional judgment, who you feel like, I feel like this is someone I can be honest and open with and maybe get some work done, okay? But please, please, please do not give up on the process altogether. So if I'm going in and things aren't working, then it's more that we need to address these three things. Either it's the type of therapy, it's, maybe I'm not really motivated to do this. Maybe I don't really want to change. Or it's, the therapist isn't a good fit for me. I am well aware that there are many, many, many mental health providers out there who might not be a good fit for you, okay? There are some, unfortunately, but truly bad therapists out there, just like there are bad doctors and bad every other occupation. So what we don't want you to do is feel like that is a reason to give up on the entire well-being of your mental health. Again, just like you wouldn't give up on the well-being of your health. Okay? So, Now let's talk about some of the modalities that are actually kind of research-driven and proved in headache and migraine literature. So the first one is this cognitive behavioral therapy. Doctors love this therapy. It has a lot of good research behind it, but I will give the caveat that a part of that is that this is a modality that was developed pretty early on and is kind of one of those that's just the most widely studied. So it's one that gets funding really easy. So I do not by any means want you to think that this is necessarily a superior therapy. Again, all of these therapies have their merits and they're just tools in a toolbox, okay? But it's really important you understand kind of this basis of why doctors especially, will often recommend cognitive behavioral therapy. So we kind of talk about the ABCs of cognitive behavioral, or CBT is what you'll more commonly hear it referred to as. And it's, antecedents, behaviors, and consequences, which essentially means that events trigger thoughts, which then trigger emotions. And so kind of those antecedents are the events, what happened, what did I do, and then how did I feel about it? Or what did I think about it, and then how did I feel about it? So irrational thoughts, or what in CBT is called cognitive distortions, are key to assigning meaning to an event. So what I thought about what happened will determine how I feel about it, right? So if I thought she was giving me a side eye, then I might feel negatively towards her. But if I thought she was just fixing her contact, then I might not feel, I'd feel pretty neutral about it, right? The other really key point is that our irrational responses become habituated. So our brain loves patterns. It loves to get into patterns. And when it gets into an emotional pattern, right? Sometimes, unfortunately, I might be having a negative reaction to something, and I continue to do that. So I start, being really hard on myself one day and talking really negatively to myself, and then it becomes easier for me to keep doing that same thing. So the aim in CBT is to help you identify, evaluate, and respond to the dysfunctional thoughts and beliefs in order to change how you then feel about kind of life in general, or events or situations that you might be in. And the focus in CBT is on the present problem, right? So sometimes you'll get a little kind of farther back if this is maybe a long-standing thought and it's kind of, where is this pattern coming from? But most of it is meant to be focused on kind of here and now and the present problem. And it will often utilize things like homework and journaling. So this is one where your therapist might say, I want you to keep a journal this week of the negative thoughts you have, because that's what we were talking about earlier. And then I want you to bring it back with me so we can kind of read through how things went for you over the last week, how you felt about things, how you experienced different things. So the cognitive distortions that are set and that we kind of watch for and want to address in CBT. All 10 of them are listed here. So mind reading. So this is when I think I can just tell what somebody else is thinking, right? Whether or not that's true. And I'm making decisions out of fear of what they're thinking, or because, I'm sure they're judging me, so I'm going to judge them first, kind of thing. So thinking you can read other people's minds, which of course none of us can actually do. So the second one is fortune telling. So I'm not even going to try because I already know what's going to happen, right? Which is, again, not true. None of us can tell the future. None of us have a magic 8-ball. Unfortunately, I would really love one. If you all find one, please give it to me. But we can't tell the future. So if we're making our decisions based off of something that we literally can't do, right? There's going to be some problems that come up there. Catastrophizing, of course. This is the I was late to work today, and then I forgot to turn that thing into my boss, and all of a sudden, really, I have convinced myself that I'm going to get fired because I walked in 5 minutes late. Okay, so it's this: something happens, and I immediately go to the worst case scenario. Labeling. So kind of generalize, or kind of putting things into categories, and no, I can't do that because that is that type of thing, or I don't want to be friends with that person because they're that type of thing. So really trying to break people into categories. Sure, we categorize in human life because we need to, kind of functionally, societally, but the plain fact of the matter is that when it comes to human beings, labels don't really work well. We're really messy. We like to kind of overlap and be confusing and complicated. So labeling can cause a lot of issues. Discounting positives. So this is, somebody gives me a compliment and, oh, whatever. But I sure hear all the negative things, okay? Or sometimes this is, well, I just feel so terrible and none of this is working, none of it. And ignoring kind of maybe some of the things that are working in your life or in your treatment, or with different things. The negative filter, I'm sure you guys also, this is related. The negative filter, of course, I'm sure you guys have all had an Eeyore friend, right? Everything is just terrible. It's the glass half empty, kind of navigating. Overgeneralizing, again, this can be just as bad, like when when things become always or every time, or this is a dangerous place to be in again because we're messy as human beings. Dichotomous thinking, so kind of that black and white thinking. I can only, everything is extreme. There is no middle ground. There's no figuring it out, like it is or it isn't. Shoulds, so this is, shoulding on yourself, right? I should do this, I should have done that, and actually just kind of building up and building kind of guilt on yourself. And then personalizing, so kind of an example of this would be, like I mentioned, somebody looks at you the wrong way and you think, oh, it's about me, it's something about me, when it might be about something completely different. Okay, so like I said, CBT is well validated in many, many things, but it's really this kind of basis of, if I can kind of slow down my thought process, can I change the way that I then kind of react to the situation? So I get on a new treatment with my doctor, but my last 3 have failed, so I am convinced that this one is going to fail too, right? And this would be that fortune telling. This one's just going to fail. It's just going to fail because they all fail. So a mixture of fortune telling and overgeneralizing, right? Can we kind of roll that back and recognize that A does not always equal B and C, and maybe we're just going through different options. How can we kind of rethink about this? Can we think of it more as, okay, you know what? It's something to try. It's certainly not going to make anything worse. And what do I have to lose, right? If it doesn't work, it doesn't work. But if it works, great. But we got to try it first. So the second therapeutic modality that is really helpful is acceptance and commitment therapy. So this is a therapy that was actually developed in the 1970s by a man named John Kabat-Zinn. And, oh no, I apologize, not this one, that's the next one. So acceptance and commitment therapy is actually a relatively new one in the history of psychology. So this is what's called a mindfulness-based therapy. So this is a therapy that, when we talk about mindfulness, focusing on the present moment, focusing on where you're at now. So the general goal of ACT is to increase what they call psychological flexibility, which is your ability to contact with the moment that you're in as you're in it, and become a more kind of fully conscious human being. And then to change and persist in behavior when doing so serves your valued goals, okay? So when I say I value something in my life, but I am not doing anything to actually work towards that, and we all do this sometimes, okay? And I should mention too, those cognitive distortions we talk about, we all do them sometimes. There's nothing to be judging yourself about if you're doing them, but sometimes they don't serve us. Sometimes they are actually creating more difficulty or more heartache than helping us. So in that acceptance and commitment therapy, it's a little bit of also what we would call an existentialist therapy. So thinking about my life and what I value and what's important to me, am I doing things, or do my behaviors match with what I say is important to me? Because oftentimes, and it's sometimes for all of us, they don't. I say that I value something, I believe that I value something, but I don't actually take any action towards it. And in fact, I might be doing opposite actions. And then I'm getting distressed because I'm not doing the things that I actually value and care about. So the 3 areas of focus in ACT are this idea that you need to be able to accept your reactions in the present moment, and then choose a value direction and take action. Okay? So this is really a therapy based around beginning to help you understand what's important to you and helping you figure out, well, then what's the next step? What do I have to do next to really be moving towards what's actually important to me? So there's 6 core processes. Acceptance is the first one. Okay? Accepting what you cannot control. Accepting where I'm at in the moment that I am in. Just being with where I'm at, because the really crazy thing is that we often get caught up in future thinking and past thinking, but the present moment is the only moment I can actually do anything in. I can actually only do something right now. So until I become aware of that and stop living in the future and in the past, I'm not going to be able to really create change, right? I need to be able to be present with where I'm at. The second is a process called cognitive diffusion. So this is changing the way you interact with and relate to your thoughts to separate the thought from the experience of the thought. Or another way I like to say this is helping you learn how to recognize in the present moment that I am not my thoughts and emotions. My thoughts and emotions are ever changing. They change by the second, by the minute, by the hour, by the day. Okay? They're just things that are kind of floating through my brain. They aren't me. I don't have to attach to them. I don't have to believe that they're true just because they're floating through my brain right now. So working on being able to recognize, oh, I'm having that thought. I'm having that negative thought. And it's just there, right? And I'm accepting it, because that's the first step we talked about, because that's just what's happening for me right now. There is nothing inherently true or absolute about what is happening. It's always changing. Our emotions and thoughts, our emotions are constantly in motion, right? We're constantly feeling differently from one second to the next. So being able to recognize that process. And then similar to the acceptance piece and part of the acceptance piece, that being present, okay? So this is practicing ongoing and most importantly, non-judgmental awareness of what's happening to me in the present moment. So sometimes in headache and migraine and chronic pain, we are very aware of what's happening in my body at the present moment, but I am absolutely judging it. I am absolutely very upset that I am experiencing so much pain right now, or I'm experiencing nausea or whatever else. So this non-judgmental piece becomes really crucial. It becomes more like, okay, can I detach from that thought of I am in pain, I am pain, and can I look at it and say, I am experiencing pain right now. I'm experiencing nausea right now. Rather than kind of wrapping myself up in the pain. Because what we know is that actually, if we look at the research, that actually will also increase your sensation of pain. So the more we think about it, the more we get stuck on it, actually our pain receptors start to fire more, and then we start experiencing more pain. So the fourth one, is self as context. So this is really working with patients to help them develop a deeper sense of self that is not dependent on experience or roles. So this is developing, in some ways I think you can think of it as a more kind of transcendent view of yourself, recognizing I am not just my thoughts and my emotions. I'm not just my relationships. I'm not just a mother or wife. I'm not just a social worker. I'm not just kind of these roles and experiences that I have. There is some innate quality in all of humanity that distinguishes us from the animal kingdom, and that there's something more there. And you can look at that from a religious context or just a spiritual context or whatever works for you. But this idea of recognizing that I'm not just all these things that are happening to me or all these roles that I play, there's something deeper to my sense of self. There's some aura of me that exists that transcends all of these things. Okay. And then once you've kind of mastered those 4 beginning concepts, then we start to identify your values. What actually matters to you? And we do things like have you start ranking. Okay? You can say all these things are important to me, but if you had to rank them, what are the things that are most important to you? Because if those are the things that are most important to you, those are where we want to start making the last step, which is this committed action. Developing new patterns, developing new strategies to be effective in those areas. And make sure that your values are, your actions are aligning with your values, that you're living a more values-consistent life. Okay, so the first 2 therapies are individual therapies with you and a therapist. But MBSR, or mindfulness-based stress reduction, is the therapy that I was talking about that was developed in the 1970s by a man named John Kabat-Zinn, and it was specifically developed actually around chronic pain, and has since been widely validated for many, many conditions, including headache and migraine. So this is a group-based intervention or therapy. And these are also other things to take into account. Whether individual therapy is more helpful for you or group, right, is something you need to kind of know about yourself. Like, am I an extrovert? Is it going to help me more to kind of have that group processing piece and those other people around kind of modeling things? Or do I really need my own space to kind of talk through things with the therapist one-on-one? So this is an 8-week group course that aims to really build mindfulness skills and help patients connect with the present moment to reduce stress, and has a lot of the same kind of tenets and viewpoints as that acceptance and commitment therapy piece that we talked about. So participants learn journaling and are expected to practice it. They do meditation and yoga and are expected to practice it. So they teach the skills, but they really require a commitment that you actually do them every day. And then at the end of the program, patients also participate in a full-day meditation retreat. So this is, like I mentioned, a group course. This is also a very skills-based course, and very specific skills. So the principles of MBSR are that it's about making the experience a challenge rather than a chore, right? So really thinking about this as like, this is something that I can do to kind of help manage these things better for myself versus, oh, this is just another thing my doctor's going to make me go do. So that's really crucial to them. An emphasis on the importance of individual effort and motivation and regular disciplined practice. It's one where they want you to commit. They want you to really try these things every day and stick to it. The immediate lifestyle change that for many people is required is to undertake that formal mindfulness practice. And the importance of making each moment count by consciously bringing it into awareness during practice. So really practicing that present moment awareness piece. Really practicing, again, getting out of that future or past thinking, right? Past would be when I'm kind of getting caught up in regret, and future is when I'm getting anxious and overwhelmed and worried about the future, or getting depressed that nothing's going to ever change, kind of thing. And then if you were to do a group like this, just also be aware that they, as a rule, make what they call medically heterogeneous environments. So there's lots of different people with lots of different diagnoses in any one group. And they do that really intentionally because they want people to be able to focus on what they have in common as they talk through things as a group, and not necessarily kind of get into the weeds about, my particular illness and what I need. Now, there are absolutely great spaces where you need to be with just people who are maybe going through a similar thing than you, things like support groups or education events, things like that. But this group, that's not the focus, and that's not the focus they want you to have. They want you to focus on what you have in common and what you can all work towards, regardless of your medical diagnosis. So, what I would like to do with this last 10 minutes is actually go through some therapeutic exercises. So these are drawing on some of the skills we've talked about from the different modalities. And there are many, many, many modalities. Okay, these are just 3 that I think are fit the best and have the best research behind them when it comes to things like headache and migraine. But these are therapeutic exercises you can also try at home, use at home, be thoughtful about. Okay, so the first one we're going to start with is actually for CBT, because that's where we started. So what I would like you to do is, I'm going to show you a picture. So this is a white bear, okay? And I want you to try as hard as you can to not think about a white bear for the next 30 seconds. And I want you to, every time you think white bear, count how many times you think white bear in 30 seconds. But I do not want you to think about a white bear, okay? So just remember, don't think about a white bear. Stop. How many times did you think white bear? So this is an exercise we do to just kind of help illustrate what we all do. So we all have things, whether it's pain or stress or depression, sadness. And when we start feeling like that, we start saying like, oh, I don't want to think about that. I don't want to feel like that. And what our brain naturally does is that's what it draws attention to. So actually, a lot of times, the more we try to push stuff away, the more we say, oh, don't do that, our brain goes, oh, that's all I'm going to be able to think about right now. Okay, now I'm stuck. Like, we're not getting out of this. So this really illustrates kind of that cognitive behavioral piece of that, of really looking at our thoughts and recognizing that sometimes what we want and how our thinking patterns are set are different, okay? And it's just kind of an exercise we do to help kind of people start thinking about their own thinking about their own thoughts, recognizing how they think or the ways in which they think, the patterns which they experience. So the other one that I would like to do, which I would bet you guys have done, hopefully, in some of your yoga classes, is just one we call our most basic deep breathing exercise, right? So this is really, really important because in our autonomic nervous system, it controls all kinds of function. It controls our bladder. It controls our stress levels. It controls our respiratory rate. And our respiratory breathing is very much tied into these same systems of stress, right? So if I get anxious and I think there's a bear chasing me, I instantly start breathing shallower, right? So as much as our stress system can affect our respiratory system, that relationship can be cyclical. So sometimes if I'm feeling high stress, using my respiratory system correctly can actually decrease my stress, right? These are tied two-way systems. So of course in deep breathing, We like to just have you put one hand on your chest. I'm going to make you do it. You are going to have to do it. And we want you to put the other hand right on your belly, right on your Buddha belly. And the goal when you're doing this is actually to kind of practice some of this mindfulness piece, is noticing when you breathe in deeply, when we're activating kind of that parasympathetic nervous system, when we're telling the brain to stop running from the bear, there should only be one hand moving, and it should be the hand on your belly. And we use the hands just so you can really be kind of consciously thinking about in through your nose, and then out through your mouth, like a straw. So just breathing in for 4 counts through your nose, holding for 4 counts, and breathing out through your mouth. And usually we want you to do this for at least 10 breaths, but if you can even do it for a couple of minutes, you would be amazed at how much it can really help with your stress levels and, by default, your pain management. And you guys can stop. How are you feeling? Anybody feel themselves relax a little bit more? Right? That's the really cool thing about this particular loop with the respiratory system, is it doesn't take very long. We're not asking you to go out and run a marathon. We're saying give yourself 2 minutes. 2 minutes every day to just breathe and let your brain do what it wants to do and release some of those relaxation chemicals that are so very helpful with dealing with pain. The other exercise that I think is really important for a lot of our patients is that sometimes communication becomes one of the big barriers. When you have a chronic condition, having to chronically communicate with your loved ones about your chronic condition can get exhausting, okay? And we know that. And so one thing that's really important to remember is that communication piece of also remembering that your relationship with each other is hopefully not just based around your chronic condition, right? That there should be other pieces taking place so that that's not always the focus. So one exercise I really like to have people do is with their loved one, just actually playing the 3 things game, okay? Super easy to do, and it's really just, what are 3 things of any question you want? Okay, so what are 3 things 3 places you want to travel? What are 3 things you want to do before you die? And the purpose of this is just that sometimes our communication patterns get in ruts, right? And we start talking about all the day-to-day stuff and the stress stuff all the time, and we stop actually communicating about those bigger, deeper, more important pieces of ourselves. So it's equally important with your loved ones. When you have emotional turmoil in your relationships, it always is going to exacerbate any chronic medical condition. It's always going to make it harder. And then that can kind of spiral into other things, and depression and anxiety and stress, right? And then we get into this really nasty cycle that we don't want to have happen. So really taking time and thought, and that's just one example. There's lots of different kind of communication and what we would call intimacy, right? So intimacy just means closeness. So creating kind of that close and emotional bond with each other as well. So that is all I'm going to torture you guys with today. I think our yoga instructor is here. So thank you guys for letting me come.